Not every medical test that sounds important actually helps after the age of 70. In Japan, a country famous for its remarkable longevity, many doctors don't follow the more tests, better health mentality. Here, healthcare is about balance. Doctors focus on what truly benefits each patient, considering their medical history, symptoms, and age. This doesn't mean tests are ignored, far from it. In Japan, they are part of a well-organized prevention system. But what's different is the selection of tests. Instead of giving every possible exam to every senior, Japanese doctors choose those with the highest proven benefit for that person's situation. According to the Ministry of Health, Labor and Welfare, unnecessary screenings can sometimes cause more harm than good, especially when the patient has no symptoms. For example, a test might sound like a great idea, but if it often produces false alarms, the patient may end up stressed, going through more invasive procedures that carry their own risks. This careful approach is part of the reason Japan manages to maintain both high life expectancy and quality of life among its seniors. Today, we'll look at 5 health tests that Japanese doctors rarely recommend after 70, especially for people who have no symptoms or special risk factors. We'll see why these tests might not be worth it, what the risks are, and what safer or more effective alternatives exist. This is not about ignoring your health, it's about protecting it by making smarter choices. As the Japanese say, ishi wa kansha to tomo ni, trust your doctor, but also take part in the decision. So, let's begin with one of the most common tests in the world, but one that is far less common in Japanese seniors over 75. Test 1. Colonoscopy after 75. A colonoscopy is a test where a doctor uses a flexible camera to look inside your large intestine, searching for growths called polyps or early signs of cancer. It's an important screening tool, but after age 75, Japanese doctors often think twice before recommending it to someone without symptoms. The reason is simple. The risks start to outweigh the benefits for many people in this age group. According to the U.S. Preventive Services Task Force, a guideline also respected in Japan, routine colonoscopies are most valuable up to age 75, and after that, they should be decided on a case-by-case basis. Why? Because while colon cancer is still a concern, the chance of finding a dangerous new cancer drops with age, while the chance of complications from the procedure goes up. Possible risks include bleeding, perforation of the intestine, and problems from sedation, and recovery is often slower for older adults. In Japan, many doctors prefer less invasive options for people over 75 who have no bowel symptoms and no strong family history of colon cancer. One common alternative is the fecal immunochemical test, FIT, which checks for hidden blood in the stool. It's simple, painless, and can be done at home. If the test finds something abnormal, then a colonoscopy may be recommended, but only when there's a good reason to do it. This selective approach helps seniors avoid unnecessary discomfort, hospital visits, and potential harm from a procedure they may not truly need. Let's be clear. Colonoscopy can be life-saving in the right situation. If you have changes in bowel habits, unexplained bleeding, or strong family history, it's still an important tool. But when you're healthy, symptom-free, and over 75, the Japanese philosophy is, don't fix what isn't broken, but keep an eye on it. By focusing on less invasive monitoring, Japanese seniors often keep both their independence and peace of mind. Next, we'll move on to another common test that becomes less helpful, and sometimes even stressful. Test 2, mammogram after 74. A mammogram is an X-ray of the breast, used to look for early signs of breast cancer before symptoms appear. In Japan, the national guidelines recommend mammograms every 2 years for women between the ages of 40 and 74. After 74, however, Japanese doctors rarely recommend routine mammograms for women without symptoms or high-risk family history. Studies, including those published in BMC Public Health, show that after this age, the benefits of mammograms decrease, while the risks of false positives and overdiagnosis increase. A false positive means the test suggests cancer is present when it's not, leading to anxiety, more tests, and sometimes even unnecessary biopsies. Overdiagnosis happens when a cancer is found that would never have caused symptoms or harm during the patient's lifetime, yet it still gets treated aggressively. For many older women in Japan, avoiding unnecessary stress is as important as avoiding unnecessary surgery. Instead of routine mammograms after 74, doctors may suggest watchful waiting, paying attention to any new changes in the breasts and reporting them promptly. If there are new lumps, changes in skin texture, or unexplained discharge, diagnostic imaging can be done quickly. This targeted approach helps avoid the emotional roller coaster of false alarms, while still catching serious cases early when they do occur. The Japanese philosophy here is similar to other tests. Focus on what matters most at each stage of life. For some women, the peace of mind that comes from not undergoing repeated screenings is worth as much as the screening itself. Ultimately, it's a personal decision made with a trusted doctor. But in Japan, that decision is often to stop routine mammograms after 74 unless there's a clear reason to continue. Next, we'll look at another test that might seem harmless, the full annual blood test. Test 3. Full annual blood panel without symptoms. In Japan, it's common for companies and private clinics to offer a Ningen doc, a complete health checkup that often includes a full set of blood tests. These packages can be impressive, with dozens of tests run even for people who feel perfectly fine. But Japanese doctors, especially those working with seniors, are cautious about ordering full blood panels every single year without specific medical reasons. Studies in Japan have shown that frequent broad testing in healthy older adults often finds small abnormalities that don't actually mean disease. This can trigger more tests, hospital visits, and even unnecessary treatments, a phenomenon called overscreening. For example, a slightly high liver enzyme might just be a normal fluctuation, but it could lead to ultrasounds, MRIs, or even biopsies that carry their own risks. The Japanese approach is to order blood work selectively, targeting only the tests that are most relevant for a person's health status and history. This not only avoids unnecessary worry, but also reduces the chance of finding something that leads to more harm than help. When there's a change in symptoms, like fatigue, weight loss, or new pain, then a targeted set of blood tests makes sense. This way, each test has a clear purpose, and the results are easier to interpret in the context of that person's actual health. According to Japanese health researchers, this approach saves both time and money, and spares seniors from unnecessary medical anxiety. In the end, blood tests are a powerful tool, but like any tool, they should be used at the right time, for the right reason. For seniors in Japan, the priority is staying healthy through diet, activity, and early attention to real symptoms, not chasing every possible number on a lab report. Test 4. Abdominal ultrasound without symptoms. An abdominal ultrasound uses sound waves to create images of organs like the liver, kidneys, pancreas, and gallbladder. It's safe, painless, and doesn't involve radiation, which is why it's so popular in Japan's private checkup packages. But when done without symptoms or a clear reason, it can often reveal tiny harmless findings that cause more stress than benefit. These can include small cysts in the liver or kidneys, gallbladder polyps, or other minor irregularities that will never cause problems. Still, once they're found, many patients feel anxious and want further testing, sometimes leading to CT scans, MRIs, or even surgery. Japanese medical guidelines caution against routine abdominal ultrasounds in healthy adults without symptoms for exactly this reason. Instead, doctors reserve this test for cases where there are digestive symptoms, abnormal blood test results, or a strong family history of certain diseases. For example, if blood tests show elevated liver enzymes, an ultrasound can quickly check for liver disease or gallstones. But doing it just to look around in someone who feels fine can easily lead to overdiagnosis, finding issues that aren't really issues. The result? More appointments, more tests, more worry, and often no change in actual health. In Japanese culture, avoiding unnecessary disruption to daily life is highly valued, and that includes medical care. By focusing on targeted testing, seniors can enjoy more peace of mind and fewer unnecessary hospital visits. Of course, if new symptoms appear, like abdominal pain, unexplained weight loss, or changes in digestion, an ultrasound can be a fast and useful first step. But for healthy people over 70 with no symptoms, the Japanese medical approach is, don't look for trouble where there is none. Test 5. Electrocardiogram without symptoms. An electrocardiogram, or ECG, is a test that records the electrical signals of your heart. It's quick, painless, and often part of routine checkups in many countries. But in Japan, doctors rarely recommend an ECG every year for healthy seniors who have no heart symptoms. According to studies published in the Journal of the American Medical Association, routine ECGs in people without symptoms almost never change treatment plans, but they can lead to unnecessary follow-up tests. For example, a harmless variation in heart rhythm could trigger stress tests, echocardiograms, or even invasive procedures that weren't really needed. The Japanese approach is to reserve ECGs for specific cases, such as chest pain, shortness of breath, palpitations, or when starting certain medications. This helps ensure the test is used when it's most likely to provide valuable information. For healthy seniors, annual ECGs often end up being false alarms that cause unnecessary anxiety. Instead, doctors may suggest simple lifestyle monitoring, tracking pulse at home, staying active, and watching for new symptoms. If a change is noticed, then an ECG can be performed promptly and with a clear reason behind it. This selective use aligns with Japan's broader healthcare philosophy. Do what's necessary, but avoid what's not. For seniors, that means focusing on living well day to day, rather than chasing every possible medical test just for reassurance. By avoiding unnecessary ECGs, Japanese seniors save time, reduce stress, and still get the care they need when it matters most. Now that we've gone through the 5 tests Japanese doctors rarely recommend after 70, let's wrap up with the bigger lesson behind all of this. Health after 70 is not about doing more. It's about doing what truly matters. In Japan, doctors aim to protect their patients from unnecessary stress, invasive procedures, and the hidden risks of over-testing. This doesn't mean ignoring medical care. It means making careful, informed choices about which tests are worth the time, effort, and possible side effects. As with all health decisions, the best choice is the one made together with your doctor, based on your personal history, current symptoms, and overall well-being. This is not medical advice. It's general information based on Japanese and international guidelines. Always consult your own healthcare provider. By focusing only on tests that offer real benefit, you free yourself to spend more time on the things that keep you truly healthy: movement, good food, connection, and purpose. And perhaps that's the quiet secret behind Japan's long, vibrant lives. Not chasing every possible result, but living each day with intention. If you'd like to discover more about the daily habits and gentle routines that keep Japanese elders active and independent well into their 80s and 90s, you'll find a link in the description to my complete guide. Your health is your story. Make sure every chapter counts.